Hello, I'm Dr. Rohini, a fertility specialist working in Vardhan Fertility Centre. So today I'm going to discuss how PCOS is going to affect your fertility. One of the common reasons why women find it difficult to conceive is due to PCOS. First of all, to know what is abnormal, we have to know what is normal. So every month in a woman, one egg grows per cycle and that is released at the time of ovulation. This egg grows in fluid-filled sac called follicle. As the cycle progresses from the time of your periods, this follicle grows in size, and in this the egg maturity happens, and right at the time of ovulation, that may be around 14th day, the egg is released and it meets the sperm and the baby is formed. So this is how the cycle happens in a normal woman with normal hormone levels. In case of a woman with PCOS, what happens is instead of one of these fluid-filled sac called follicles growing, there are multiple follicles which grow, but none of them harbor the mature egg. So the ovulation or the egg release does not happen. So that is the reason why pregnancy doesn't happen. The second reason is even though the egg is released, it may not be of good quality. So today I am going to walk you through step by step how we manage a woman who comes to our clinic with PCOS. So once the woman walks in, first of all, we advise her lifestyle modifications, which are small steps, but they do make a lot of difference, because what we have noticed is that even 5% reduction in weight can increase the egg quality and cause regression of this condition and may cause release of egg on its own. Despite the weight loss, if the woman doesn't respond, then we would start her on a treatment called ovulation induction. So in this, we would take the help of few medicines like letrozole and clomiphene, which would help in the growth of this follicle so that a mature egg is released during the time of ovulation. So what we would be doing is we would be giving medication to the patient from second day to sixth day of her periods, and then we would be calling her for a scan 3-4 days later, and we would be checking the growth of the size of follicle. And when we feel that the follicle is mature enough or has grown well enough, that time we would give an injection for the release of egg, and then we would advise her to have intercourse with her husband right at the time of egg release. This would increase her chances of conception. So now this treatment is given for 2 to 3 months. In case she doesn't conceive after this, then the next step would be a process called IUI, that is intrauterine insemination. So in this process, we would be following the same steps. We would be giving medications so that the egg release happens. But instead of asking the patient to try naturally, what we would be doing is taking the patient's husband's semen and processing it so that all the impurities are removed, and the good quality semen is directly injected into the woman's uterus. This increases her chances of conception, which would be around 20 to 30%. Now, there are certain situations where we would be giving this medicines to increase the size of the follicle, or which would help in egg release. But despite giving these medications and some hormonal injections, still the woman does not respond and her follicles do not grow. So, in this condition, what we would be doing for the patient is opting for a surgical method. We would be doing a procedure called laparoscopic ovarian drilling. In this, this is a day care procedure which does not require any admission. In this, we would be putting small instruments around 1 centimeter size inside the patient's tummy. This whole process is done under anesthesia, so the patient will not experience any kind of pain. And we would be putting these instruments and a small camera inside the patient's tummy, and we would be seeing everything outside on a TV, and then we would be using laser to burn this fluid filled sacs in the ovary. This will bring back the hormone levels to normal. After that, we have noticed that after doing this procedure, most of the patients conceive on their own without the requirement of any medicine. And also during this procedure, we can also have a look at the fallopian tubes, whether they are functioning or not. Because for a healthy pregnancy to happen in a woman, we need a good uterus, we need good fallopian tubes, which would carry the egg and the baby to the uterus, and also healthy ovaries. So all these three things are checked during the procedure. So after this, we would let the patient try on her own. In case if that does not happen, we would be again giving her a trial of doing intrauterine insemination. Sometimes we have found that despite doing the surgery, despite doing IUI procedures, also the woman may not conceive. That usually happens because PCOS inherently, the quality of egg is not good, which we cannot predict by just doing an IUI. And there may be other factors which may be contributing to this. Maybe the woman would be of a more advanced age, or maybe she might have other uterine problems, when there are multiple problems with the patient along with PCOS, then the next option after IUI would be to go for a procedure called IVF, that is in vitro fertilization, or test tube baby procedure. In this, we would be giving multiple injections to the patient when she comes on the second day of her periods, and then after around 10 days of injection, we would be doing a procedure where we would be taking her out all the eggs that have become matured. This procedure is called oocyte pickup procedure, and this is done under sedation. Again, the patient would not be able to feel any pain or discomfort, and these eggs are taken out and they are fertilized in the lab. And then on the next cycle, we would be choosing the good quality embryos or good quality babies out of the all the babies that are formed, and then we would be transferring these embryos into the patient's uterus. The success rate is around 40 to 50%. So these are the common treatments that we are doing for patients with PCOS. Starting from ovulation induction to laparoscopic ovarian drilling, and then IUI, and when everything else fails, IVF. So with this, today we come to an end to our discussion, and if you have any further doubts, please feel free to contact us. We will be giving you the contact details, and or you can just come and directly visit us at Vardhan Fertility Centre.